The Northern Territory is proud to be developing e-health solutions that advance healthcare delivery. eHealth NT is a partnership between the Northern Territory Department of Health and Families, the Department of Health and Ageing and General Practice Network Northern Territory. We have implemented a fully electronic advanced medication management system in a residential aged care facility in the city of Palmerston, which is just south of Darwin. The advanced medication management system enables fully electronic prescribing by the doctors, administration recording by the nurses, as well as pharmacy reviews and dispensing, all online. The implementation has shown how easy it can be to convert a paper-based system to an electronic system with a well-designed product. The implementation is recognised nationally and clearly demonstrates the delivery of e-health benefits to health providers as well as consumers in the aged care sector. The following is a live demonstration of how our system works in the various locations in Darwin.
We're here today to demonstrate Medchart and its use in aged care facilities. Very simple to access. Through the patient search screen, I'm able to search for my patients. Now, the medication chart on Hattrick's Medchart looks the same as the medication charts that I've been using in aged care facilities, which have been paper-based. The difference that you will notice is that you can tell when medications have been dispensed and if they've been dispensed much more clearly. This also has the facility for pharmacists to leave me a note or the nurses to leave me a note if there are any changes needed in the patient's prescription. I can change the number of tablets, I can change the strength, I can change if it's by oral tablets or oral liquid. I can change when it's given. I can change it to, for example, 3 times a week, which traditionally has been quite hard to do on a paper-based chart. That will then take me back to the medication chart and tell me now that there is an update to be done. I can look then at the references that are available to tell me about medication safety and cross-reactions. This is particularly valid when adding a new medication, to see that there are no problems with existing medication. I am able to again click on the medication that I have already written through and send that script digitally from this system at the aged care facility. That is digitally signed and a legal prescription without me having to write that. There are lots of added features. It's easy to see the summary of allergies and intolerances. It's easy to see when I have changed past prescriptions and why, and it's easy as a tool to support my decision-making processes about medication and how they're being used on the ground in the aged care facility. Thank you.
The beauty of Medchart is we no longer have to rely on the nursing home to fax through paper-based medication charts. We're able to log on wirelessly through the internet and access the patient's medication chart, live medication chart, which is a vast improvement on the paper-based system. Through Medchart, the GP can sign and send scripts electronically through to the pharmacy. This is a great improvement on the paper-based process where pharmacists can sometimes be chasing up prescriptions that forget to get written or alternatively get lost in the process from the transition from the aged care facility through to the pharmacy. Medchart enhances the communication between all partners of the care team in the aged care facility. Between the pharmacist and the nurse obviously can communicate to us with orders or changes or anything that they need carried out to continue their care. Also, the pharmacist is able to put into Medchart administration instructions, so with food or non-crushable medications. That information is accessible at the point of administration, which is where the information is required. Medchart gives the pharmacist the ability, for the first time ever, to have input into the GP's prescribing in the aged care facility. This is through the use of both quick lists and prescribing protocols, which greatly enhance the quality use of medications within these aged care facilities. Medchart has improved the efficiency of providing services to the aged care facility. Through the enhanced communication, we're not having to chase owing scripts, charts, illegible scripts. So the whole process has been streamlined to produce greater efficiency for everybody involved, and at the end of the day it results in a better care for the patient.
My knowledge of computers was how to switch them on and off and how to save and find an email and send one. That was it. In terms of learning to use Medchart, I had no problems at all. It took a couple of days and perhaps a week longer to become comfortable with it. Before, when I wanted to communicate with a doctor or the pharmacy, it was first of all a phone call, followed by a fax, followed by faxing medication charts. It was a slow response. You'd get no response that day. You'd be lucky the next day and you'd get the drug the third day. If you made an error on the old chart, there was no way to correct that error rather than to put a great big alert in, and now you can correct it straight away. Implementation of Hatrix has increased the quality of care for the residents at Terrace Gardens. It's a very safe system for administering medications. It's an easy system for getting medications for the residents, for communicating with the doctors and chemists.
It seems to be a bit quicker because it's all there in front of you and it's easier to read. Everything's there simply, whereas before the Medcharts used to be really hard to read. Doctor's writing's not the best. And you can at least see if the medication has been given. Sometimes the residents ask what the medications, why they're taking the medications and what they're for, and we can go to the referencing to explain to them why the medication, why the doctor's ordered that medication for them, and it's helped with that.
It's hugely improved our ability to monitor and audit because we don't have to spend 3-4 days or a week chasing papers, bits of notes popped in here and there. It's straight on the system, clear and in front of us.
Oh, sorry, excuse me. Hello? I see. Oh, Maria? Just excuse me, Andrew. Yeah, sure. How long's she been sick? Okay, has she had a fever all that time? Sure. Okay, well, look, what I'll do, you're in luck, I'm here with my laptop today, and so I'll be able to write a script from here via the internet, and you'll be able to pick that up and treat her later today. So I'll do that now. Is that okay? Yeah, sure. Okay. Okay, it's all done. That's just amazing.
Yes, that's very impressive.
This little old lady in the aged care facility, she doesn't even know what a computer is. And that's made the difference probably of 48 hours between her getting treated because I've been able to do it now.
Good morning, Phyllis. Good morning. Just got your medications for you to take, darling. Here's the water. Come on, Phil. And here's your tablet, sweetie. I'll hold the water while you take one out.
Take all these?
Oh, one at a time, yep. Okay then, thank you.
Thank you.
Have a good day. Yes, thank you.
Thank you. Thank you, Nat.
eHealth NT would like to thank the following individuals for their contributions to this major eHealth NT initiative. Dr. Elizabeth Moore, Dr. Janine Richardson, Mr. Michael Crozer, Marianne Walton, Marissa Kelcher, Judy Trevina. We would also like to acknowledge the tremendous support from our core partners, GPN NT, Frontier Services, Hatrix, Argus Connect and Stewart Park Pharmacy. We are proud of these achievements at Terrace Gardens Aged Care Facility.